So what brought me to work at Claiborne Memorial is I'm really passionate about rural medicine, and a lot of rural medicine and small hospitals are kind of dying in America, and Claiborne is a hospital that is doing great. The community is very involved, and that speaks to me, so I wanted to be part of something like that.
Claiborne Parish is 17,000 people. It is the sportsman's paradise. We have a beautiful lake that is what the parish is really known for. I'm passionate about what I do because, number one, I live in Claiborne Parish. The people that are our patients are people that I go to church with, that I go to grocery shopping with. They don't deserve any less because they live here and don't have transportation or don't have the resources that other communities have.
Claiborne Parish is an almost cookie-cutter example of rural America medicine. Rural populations have to address a lot of disparities in healthcare, and that's why I'm doing this residency. Every provider here, every primary care physician, has always been interested in teaching. We were approached by Willis, Knighton Health Systems out of Shreveport about starting a rural residency program.
I know we have the best doctors in the United States, I think, especially in rural medicine. And if we can train them here to be the very best, then we can provide them to other rural hospitals that are in need too. It's hard to find people that want to be in rural America. And if they train in rural America, chances are they want to stay there.
We actually did not pass our first application. We were very disappointed and a little bit dejected, but we didn't feel we had lost the battle. So we regrouped.
Can we do this again? If we're going to do this again, we got really one more shot. So we reached out to RRPD to try to get accredited a second time around. I mean, there's so many things that the Rural Planning Development Grant was able to help us. It ended up being so much more than the financial piece. I could ask the questions that I had been asking with no answers. Then there were the technical assistant dollars that were there that are in addition to what the actual grant was for.
Those funds allowed us to hire a consultant who had deep experience with applications for family medicine programs. And Dr. Carrie Bergeson was our consultant, and she was wonderful. My personal opinion is without her, we probably would not have been successful even the second time. March 15th generally is match day. Well, we had hoped to be accredited before March 15th. That didn't happen. We were accredited about April 18th, a full month after match. Basically, we had missed out on the big deal.
And we knew we wanted to pick the perfect applicants. We didn't want somebody who was just settling for something. We wanted somebody who really wanted rural medicine. We were able to find a couple that wanted rural medicine that had not matched for whatever reason. And just in the nick of time, we were able to get them here, and they start on July 1.
So I was attracted to the Claiborne Memorial Rural Family Medicine Program because of its establishment in this community and how well they have served everyone here, and the experience of the faculty here at the program. Between Dr. Salmon and Dr. Absher, they have over 7 years of medical experience, and the new faculty brings in a good wave of new knowledge as well as new practices, and we can combine that. So it's a huge wealth of knowledge, and both of us that are here as the residents, we have a lot to learn, and this is a great place to do it.
I think during this residency, I'm most looking forward to really becoming part of the community here and developing relationships with patients. I kind of like the idea of somebody can walk up to you just around town and you're their doctor.
The mission is to train family medicine physicians who understand the rural culture and who want to practice in a rural community. When they leave this residency, when they leave this community, that wherever they go, that they will be prepared. They will feel competent because they will be competent. They will feel confident because they will have confidence that they did a residency that prepared them for rural medicine.
We do not have access to the multiple specialists that the big cities and the big hospitals have access to. So we have to provide that bridge in between primary care and the specialists. So we have to do a lot of extra care that is not taught in traditional family medicine training programs.
To train here is to practice here. And to practice here is really what the training is about. You can't separate them.
I want to practice in a rural community because I feel like the rural population is one that doesn't have access to great care. I've seen a lot of my relatives have to drive several hours to see a provider that they feel like they can trust.
So many of these communities have provided a backbone for taking care of the rest of the country for generations. In this region, we have a huge lumber production. They're working very hard. You have farmers in the Midwest that are producing a great amount of crops to take care of folks. And at the end of the day, we need people to take care of them.
I think the RRPD program is so important because it is so hard when you're in rural America and you're trying to recruit physicians, recruit staff, and you feel so all alone. So the RRPD brings people together that are here for the same reasons, and we're all facing the same challenges. We can all ask the same questions, and it's like you're not out there all alone all of a sudden.
They led us to what path we should take to success, because the path we had taken, we weren't close to success. They opened a door for us in helping us through this process, and it is an arduous process. The application of residency compliance with the ACGME is not for those who don't want to engage. It wasn't just the funds, it was the organization.
The support that you get from the advisors and the people that are already in the grant program, that kind of advice you can't just get anywhere, and the RRPD program makes it so simple. It's all in one place. It's possible to do a rural family residency program. You just have to put the effort in, and RRPD is the way to help you get there.